Hey hon, how are you? Haven't seen you in a while over here. You just here for a quick checkup? Cranial nerve exam? What are you here for? Okay, let's take a quick look at you. I just need to put another glove on so we can feel you. And yeah, so give me 1 second. I'm just going to feel your face. Feel your face. My glove's cold. I'm trying to warm them up before. Feel your face. Do you feel the pressure? Is it the same on both sides? Do you feel it? Okay. Nice. That should be fine. Okay. So now let's look at my fingers. Okay. I'm sorry, there's a train going by, but hopefully that's not too loud for you. I know that you have to get back to school though, so we won't wait for it to pass. We're just gonna go right into it, okay? So now take a look at my fingers. Do they look the same on both sides? Okay, how about now? One's farther. Okay, how about now? Okay, now how many fingers am I holding up over here? How many over here? How many here? 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 Okay, here? Okay. No fingers? Okay. Good. Now, I'm gonna press on your lymph nodes, see if anything is swollen. Everything feels pretty much good over here. Doesn't raise any red flags for me. Do lights bother you? How about now? Do they bother you? No? Does purple affect your eyes in any way, shape, or form? Okay. Green? No? Okay. And orange? That's fine? Okay. Good. Okay. So now I'm going to offer you a drink if you'd like. I have some Gatorade. The zero version, of course, we like to keep low sugar. I hope you are doing that at home as well. You want one? It was in the fridge, so it's nice and cold. Alright, here, let me open it for you. Alright, here you go. Try not to make a mess, please. Thank you. So now let's just take a listen. We can just take a quick listen to your heart. Make sure that everything's functioning the way that it should be. I always put it on the wrong way. Every single time. Okay. So we are going to take a quick listen to your heart. Please sit still. Okay, so now I'm gonna place it on your back. It's gonna be a little bit cold, so just relax. Don't be worried about it. Okay, so I'm just gonna go right on your back. Right on your back. Okay, breathe in. 1, 2, 3. Breathe out. Okay, breathe in. Breathe out. One more time. I'm gonna just move it over here. Breathe in. Breathe out. Very good. I don't hear anything. No fluid. It sounds empty, which is what we want when we're listening to the lungs. But let's just move on. There's other exams that I would like to do for you today. So make sure you're drinking, hydrating. But for now, let's just grab a light. Okay. So this is one of my favorite parts of the exam because it really helps us get to know what's going on with the patient. Okay, so you're going to follow this light and pretty much do what I say when it comes to this. Alright, so ready? You can blink as many times as you want to prepare yourself. I know the light isn't always comfortable, but don't worry, I'll give you some drops for afterwards, okay? So now, follow the light. Okay, where is the light? Okay, how about now? Now? Okay, do you see it? How about now? Do you see the light? Do you see the light? Where's the light now? Okay, yes, it's off. All right. Do you see the light? Okay. How about now? Okay, good. Now, another one. I'm just gonna look real close into your eyes. Okay, you take a quick blink. Okay, real close, real close. Okay, they are dilating with light. They are, okay. Dilate, small, big, whatever. They're reactive, so it looks good to me. Here, let me give you quickly some eye drops. We have Visine here. They do send us free samples every now and then. So you're more than welcome to take it home if you need it, but I don't think it's very necessary. So just quick blink, blink. Okay, great. So looks good to me. Your eyes are hydrated. Do you feel okay? Okay, good. So now that we've completed our exam, I can take the gloves off. You're okay with that, right? We do like to decontaminate our hands afterwards, so let me make sure that I'm doing that always. I do have this hand sanitizer on me at all times, so please don't worry about any infection. I'm very clean, okay? So now I'm gonna ask you a couple more questions, and this will just be to make sure that your vision is all good and normal, okay? So give me a second. I'm gonna bring up the vision test in a moment. Okay, how are you doing after that eye test? You're doing okay? Okay, so now we're just gonna follow it up with yet another eye test. Sorry, but you kind of knew what you signed up for when you got to the doctor. Okay, so it's gonna be very simple. Very simple. If your eyes are healthy, then you'll be able to pass with flying colors. It's a little bit of wordplay. We're checking to see your colors today. You like my background, by the way? It's for Valentine's Day. Very cute. I know. Okay, so let me just open up where I have saved the information for today's exam, and I will also be charting some of your info here as well, okay? So okay, so we're gonna be looking here at this photo. It's gonna get a little bit easier as we proceed with this exam. So if you see the colors better, or if you see the numbers better, then that says a lot about your eyes. So we're gonna start from here. What number do you see? What number do you see? Okay. How about here? You're close. Okay, next. What number? Okay. And here? Okay. Here? I'm just gonna jump to this one. How about here? It's kind of hard to see. Okay, so you struggle with this color. How about over here? Okay. And we'll just skip around and just do this one. What number is this? Okay, great. So like I said, it's gonna be easier the more numbers that you see. So we're gonna skip to this one. They are different than the last. Might be a little bit easier now that we are familiar. So what number is this? 8, okay. And what number is this? 7, good. Okay. And what number is this? 13, very good. Okay. What number is this? 12, okay. What number is this? 9, okay. And lastly, what number is this over here in the corner? 16, very good, very good. You passed with fine colors there. I did notice over here in this section you struggled a little bit with this, and then the bottom row you struggled as well, but understandable. As long as you pass with a good score on the second photo, we won't hold you back for glasses or anything like that. I know how expensive colorblind glasses can be, so we're just gonna avoid that, and we can move on, really. So let's move on to the next eye exam and make sure that everything's okay. Then you can go home if you'd like, or I can conduct a few more tests depending on the results. So let's just get on with it. So I don't know if you're familiar, but there is an eye examination that's called the it uses the Snellen Eye Chart. We only have this chart, and currently it's been wiped of all the information. So we're gonna have to write it out to do this exam, and then we'll be set. I mean, you have to understand that we are a more low budget doctor's office, and not everything is gonna be available when we need it, okay? So please bear with us. But hopefully you're able to get them all correctly regardless of the circumstance, okay? So I'm gonna do PED. You know what, I'm gonna have to erase. This is looking like really uneven. Let's start over. Okay, it's gonna have to be like written much smaller. Worry just that you won't be able to see it. Okay, so now that we have the first set of letters, we kind of just draw this green line to show that there's going to be a new transition. Pretty much that the values are getting much smaller. So there's an understanding that if you get them wrong, it's less unforgiving, I guess. If you know what I mean. So that is that. And then we're gonna get even smaller with the red portion. And so if you can't see that, you really don't need too many glasses. But above this line, it's like, you really need glasses. But like below, it's like, I get it. You know what I mean? So that's pretty much the dealio. Okay, so we are very well prepped here. You're going to be looking at this eye chart and making sure that you understand what it says, okay? If you get anything wrong, I swear I'm sending you to the ophthalmologist, and you are getting glasses today. Okay, understand me? So please pay attention and focus on this section of the exam. It's very important, and there's no backsies. No backsies. If you get it wrong, I'm marking it down. Okay, let's begin. So I will use a pointer, so you are absolutely sure. Pointer of the color that you can actually see, not the red stuff. I know you struggle. But I'm gonna need you to cover an eye. Cover whichever eye you want to go with first, left or right, and then we'll switch, okay? So make sure you're only covering one eye, not too much pressure, because then when we switch, it might be a little bit blurry and it's going to affect your sighting. And so you might need glasses sooner. So let's not do that in light pressure. We're not frightening your face. Okay, first one. Okay, very good. Read me the second row. Okay, third row. This is a Z. So I'm going to mark down that you got that wrong. Okay. Okay, let's continue. What does that say? That. Very good. This. That's a D. Okay. Marked. What letter is this? Excellent way I thought, but you know this letter now, remember? Okay, good. And this whole row, read it to me. Very good. You messed up this one, but it's kind of because I wiped it off. It's my bad. I won't count it wrong. How about this? That's not a 3. That's an E. Okay, so we're gonna mark that too. I'm sorry, but you're gonna need glasses. I told you, what did I say? Below that line, absolutely, I mean, it's forgiving, but above it, you got both. Okay, what's that? Very good. And this entire row, read it. Okay, what about this row? Okay, so you pretty much messed up every single letter in that last row. But like I said, forgiving, not so forgiving. So we're gonna have to send you to the eye doctor, and he's gonna do a more thorough test. Okay. Turns out you might need to take this home with you and fix that. Okay. Very good. Let's move on. It's about time. Okay, I'm back. I have these in, but they kind of hurt, so I'm just gonna take them out for a second. But these are my second pair of stethoscopes. So I'm just going to take the blood pressure, and then you can leave. There's no other exam I have written down for you today. It looks like, I mean, you failed the eye test. Your physical was fine though. No swollen lymph nodes, and your face, you can feel it on both sides. So you basically passed a cranial nerve exam. But let's just take a quick blood pressure. Make sure your heart's not too elevated. This exam might have caused a little bit of stress for you, and I totally get that, but if it did, you're gonna need to be put on medication stat, okay? So even though you might think you're super healthy, after this exam, depending on the results, things might change, alright? So let's just continue with the test and see how things go. You could have a perfectly healthy heartbeat, but we're gonna find out right now. So I'm just gonna wrap that. Is that okay with your left arm? Okay. Do you mind holding this? It's kind of hard to place it down. Alright. So I'm going to pump air basically into the pressure cup, and I'm going to be holding my stethoscope, my finger down right on your radial nerve so that I can get a good pressure on the pulse, okay? Pretty much. Okay. So, and then I just undo it when I'm done, in case you're interested. I know some people are very interested in the heart and would like to know more, so I'm here for you. And ultimately, we're looking for somewhere between 120 over 80, or like plus or minus 10 above that. Below that, anything more is pretty much gonna be concern for us. Okay, so let's just get pumping. No more talking. Please be quiet. I have these on. Makes it really uncomfortable if you talk, so please okay. Please hold the thing still. Okay, I've got the first number, so I'm just gonna release. Release all the air. Okay, perfect. So I got the second number. Yeah, it was like 120 over 70, so you're looking pretty good. I'm not concerned with that. Your heartbeat is healthy, you are normal. The only thing is you need to get your eyes checked, but like other than that, like you are fine, you're healthy. Yeah, so that'll be fine. Don't cry. You'll be fine. Glasses are not a big deal. Matter of fact, I have mine around here. Okay, they're over there, but you know, I wear glasses too, so it's not a big deal. Alright, so I will see you next time. Let me write that script for you to go see the ophthalmologist. Highly recommend her. Her name is LT, and you know, she is pretty local, so if you'd like to go see her, let me know. I mean, you need to go see her, but if your insurance doesn't cover, you can try to find somebody else available. I'm just gonna write the script here, and let me just give it my doctor's seal of approval. And so here you go. Here is your script. Please go see her right away. She's a great doctor. Highly recommend. Right there is her actual full name, so just tell the lady at the front desk this name. Okay, so I will see you in our next meeting. Please schedule something for like I'd say like 1 to 2 months, up to you, up to your availability. If you can come to me sooner, that's better. But you seem perfectly healthy. I just want to make sure, I want to check in on you after you get those glasses scripted to you. So whenever that happens, okay, I will see you soon. Thank you guys for watching. I will see you in the next video. I always appreciate you guys stopping by, and thank you for almost 500 subscribers. I'm very excited. I'm looking forward to doing a giveaway at 1,000. So if you want to see that, I'll let you know when it's time and how to enter and what the prizes or giveaway thing is going to be. So anyways, please feel free to leave a comment in the description of what video you want to see in the future. It's not guaranteed. I try to get around to all the comments, but sometimes they just kind of get lost, and in that case just re-comment or something like that. But yeah, I try to look at them. So I love you, thank you for watching, and have a good night, have a sweet dreams, and hopefully you enjoyed our doctor's interaction. I will see you in the next one.
It seems to be a sudden general explosion of mass homicide.